Hello, this is Dr. Lauren Few with Genemind bringing you another installment of a Genecept SNP clip. In this installment, we'll discuss the SLC6A4 gene, its clinical relevance, and how to interpret test results to best serve your patient. This presentation and the Genecept assay may include discussion of drugs that are not approved by the relevant regulatory authority, including the US FDA, or the use of drugs not approved for specific indications, also known as off-label use. To assess the potential benefit and potential harm, prescribers should be familiar with the indications, precautions, and warnings of drugs used. Please consult the manufacturer's prescribing information. As some of you may already know, Genemind is a personalized medicine company that is bringing innovation to mental health care through genetic testing. The Genecept assay is one of our service offerings, and it is a comprehensive test developed in our clinical laboratory. It provides licensed and prescribing clinicians a tool to use based on their patient's own genetic information that may help guide personalized treatment selection for mental illness. Our testing is used on the order of a prescribing clinician. SNP clips are broken down into 4 basic segments to provide an introduction to the physiological significance of the protein expressed by the gene, basic information about the polymorphism in gene, and finally, what the genotype can mean clinically to your patient based on some of the current evidence. In this SNP clip, we'll focus on how the SLC6A4 genotype may influence selective serotonin reuptake inhibitor response, or SSRI, and alternative interventions available to optimize treatment plans. Serotonin, 5-hydroxytryptamine, or 5-HT, is a neurotransmitter that influences multiple processes, including autonomic function, motor activity, hormone secretion, cognition, and complex processes associated with affect, emotion, and reward. The solute carrier family 6, member 4, or SLC6A4 gene, is responsible for expressing serotonin transporters in the synapse of serotonergic neurons. Released serotonin is transported back into the presynaptic terminals via these reuptake pumps. The molecular target for SSRIs are these exact transporter proteins, and by inhibiting them, there is an increase in serotonin in the synaptic cleft. This increase in serotonin is the putative mechanism by which SSRIs treat depression or anxiety. Genetic variability in the expression of serotonin pumps is related to treatment outcomes with these medications. SLC6A4 is a 41 kilobase gene found on the long or Q arm of chromosome 17. There are 3 variants of this gene, and these include the long, short, or LG versions. A polymorphism in the promoter region of the gene, which is known as 5-HTT-LPR, results in either long or short alleles. The short allele missing 44 base pairs due to a deletion. Short, or S variants, have less transcriptional activity and result in lower serotonin reuptake than the alternative long, or L variant. The differential transcriptional activity caused by this polymorphism is influential in complex traits and diseases and treatment outcomes. In addition to the long, short alleles, there is a rare variant within some versions of the long gene that result in a single base pair substitution, an adenine, or A, to guanine, or G, substitution. This is referred to as the LG variant, and like the short variant, is associated with decreased expression of serotonin pumps. So, how frequently are the 5-HTT-LPR polymorphisms found in the population? The frequency of the SLC6A4 alleles differs quite dramatically across ethnicities. The table shown presents the genotype frequencies for individuals of European, African, and Asian descent. Notice the stark differences in frequencies. SS homozygotes occur in only 4% of Africans and 19% of Europeans, whereas almost 70% of Asians are SS. SLC6A4 is an excellent candidate for genetic studies, since serotonin transporters are one of the main targets for antidepressant drugs and the primary target for SSRIs. Furthermore, it has been associated with several psychiatric disorders with affective symptomatology, such as bipolar disorder, anxiety disorders, eating disorders, and substance abuse, as well as pathological behaviors and personality traits related to anxiety, impulsivity, and stress. In one of the largest studies of SSRI genetic response, Porcelli and colleagues conducted a meta-analysis of studies pertaining to 5-HTT-LPR. When the analysis was restricted to a Caucasian population, there was a significant correlation between 5-HTT-LPR genotype and odds of remission. The LL genotype is linked to increased odds of remission of 71% when compared to SS individuals on SSRI therapy. However, this genotype appears to be less relevant when restricted to Asian patients. In conclusion, genotyping the SLC6A4 gene may help to stratify depressed patients into tiers of SSRI response, with LL more likely to be the best responders and SS the worst responders. In a 2010 meta-analysis that looked at multiple genetic markers of antidepressant response, again, SLC6A4 was identified as a marker of antidepressant response. The SS genotype was linked to increased risk of antidepressant-induced side effects, and the greatest effects pertain to SSRI-induced side effects. Combining results of each of these large meta-analyses suggests that the serotonin transporter polymorphism is a valuable biomarker to assess response and side effect risk when prescribing SSRI antidepressants. In summary, the SLC6A4 gene, also known as 5-HTT-LPR or SERT, impacts expression of serotonin transporters, and this in turn modulates SSRI response. Those individuals with the lower expression gene, SHORT or LG, may be more likely to have poor outcomes with the common antidepressants citalopram, escitalopram, fluoxetine, fluvoxamine, paroxetine, or sertraline. As a reminder, any clinician with prescriptive authority may order the Genecept assay. There are two options for ordering the test kit to use with patients. One, through the Genemind homepage at www.genemind.com, or two, through the Genemind customer service line at 877-895-8658. Representatives are available Monday through Friday until 7 p.m. Eastern Standard Time. Thank you for your interest in Genemind and the Genecept assay. We hope this webinar was informative. Thank you.